If you're thinking about fertility treatments, you're probably aware that there are numerous options available and that there is no one-size-fits-all approach. So, with so much knowledge and alternatives at your disposal, where do you begin? This may come as no surprise, but speaking with your doctor is the best place to start. What is Crinone? Crinone is the brand name of a product that contains progesterone, which is used in fertility treatments and to restart menstrual cycles. The drug costs around $250 per tube, but we're selling it at a far lower price so that more women can access it. What is Crinone used for? Crinone vaginal gel is used in fertility treatments and to restart menstrual cycles. It contains progesterone, a female hormone that helps maintain normal pregnancy, supports the growth of tissues in your uterus, and helps prepare your body for childbirth. This medicine also prevents endometrial hyperplasia and overgrowth of cells in your uterine lining. You'll only need 1 or 2 tubes of Crinone each month during your preconception period. Side effects. Crinone, progesterone, comes with some side effects and precautions. Your doctor will review these with you before prescribing Crinone. But here are a few things you need to know beforehand. Do not start using Crinone if you are allergic to progesterone, progesterone analogs, or any of the gel's inactive ingredients. Ask a pharmacist if you're not sure about the inactive ingredients in Crinone. Have you experienced odd vaginal bleeding that has not been evaluated by a physician? Have a history of liver disease or have had a history of liver illness? Having cancer of the breasts or genital organs, or have had cancer of the breasts or genital organs? If you've suffered a miscarriage, your doctor may assume that the tissue is remaining in your uterus. Have or had blood clots in the legs, lungs, eyes, or other parts of the body. Common side effects: breast growth, sleepiness, constipation, mood swings, nausea, headache, depression, trouble sleeping, pain around the vaginal opening, nervousness, cramps, breast pain, urinating in the middle of the night, stomach pain, lowered sex drive. How does Crinone work? Progesterone is released naturally during a woman's ovulation cycle to thicken and promote your uterine lining as it prepares for fertilization. If pregnancy does not occur, progesterone levels will decrease again, causing menstrual bleeding. Hormones can also be administered to patients who are undergoing fertility treatments in an effort to increase progesterone levels to prepare a woman's uterus for embryo implantation. Please be advised, it's critical to use Crinone, progesterone, for the full duration of your reproductive treatment. This could take up to 10 weeks. This increases your chances of becoming pregnant and staying pregnant. Do not stop taking this medication before the doctor tells you to. Crinone, progesterone, is available in 2 strengths as a vaginal gel, 4% and 8%. Increasing the concentration of the 4% gel is not the same as increasing the concentration of the 8% gel. Don't take more Crinone, progesterone, than your doctor recommends. How to use Crinone. Vaginal progesterone can be used to restart your menstrual cycle if you recently stopped using birth control or if you're not ovulating. This medication can also be used as part of fertility treatments for women trying to conceive a child. Since it contains hormones, vaginal progesterone should only be administered by a physician. For instructions on how to use Crinone and what side effects may occur, read our detailed guide here. How to use Crinone. Follow these steps carefully or as instructed by your doctor. 1. Use soap and water to thoroughly clean your hands. 2. Open the sealed packaging and remove the applicator. 3. At this time, do not remove the twist-off tab. 4. Take the applicator by the thick end and hold it there. To ensure that the contents are at the narrow end, shake down many times like a thermometer. 5. The thin-end plastic ball aids the gel's movement down to the applicator's tip. The ball also aids in the control of the gel's release. The applicator is made in such a way that the ball cannot escape. 7. Carefully place the applicator into the vaginal opening while sitting or lying down on your back with your knees bent. Insert the narrow end of the applicator into the vaginal canal gently. 8. Firmly squeeze the applicator's thick end to push the gel into the vagina. Remove the applicator and throw it away in a trash can. It's possible that some gel remains in the applicator. Don't worry, you'll still get the right amount of medicine. Crinone covers the vaginal lining to ensure long-term progesterone release. What are the optional choices to Crinone? Endometrium, progesterone, prometrium. For medication to treat vaginal and other sexual healthcare ailments, please visit ziprx.ca.